I'm Dr. Bill Adams, and you're watching the Plastic Surgery Channel.
Hello, I'm Deanne Moore, and welcome to Plastic Surgery News. Thank you for joining us today. In this week's report, we'll find out about a contest that will award one lucky winner a more youthful look. And then we'll zoom in on a story that details who is getting plastic surgery in America, and it's not just the rich and famous, or even just the rich. And we'll hear about a gel that's taking some of the sting out of laser therapy. But first, a Chicago plastic surgeon has hit the spotlight with his innovative use of Botox, in this case aiming it at acne instead of wrinkles. It seems that Dr. Anil Shah has devised a way to help rub out acne breakouts by injecting problem areas with Botox. Ordinarily, of course, the drug is used to reduce the appearance of lines on the forehead and around the eyes. It does this by preventing the facial muscles in those areas from contracting. But Dr. Shah's new experiments indicate that this same drug can be just as effective in preventing contractions in the pores of our skin. So far, Shah has used Botox to treat acne in 100 patients. He has found that injecting Botox into the skin can essentially freeze the pores into place. This quickly prevents them from producing excess oil, and as a result, patients no longer experience the greasy clogging in their pores that leads to acne. Shah's experiments also show that the new Botox treatment and its effects can shrink pores by reducing their inflammation. All these new advantages will result in healthier skin that functions with more stability. But Medical News Today recently reported that the new anti-acne technique must be carried out with caution. Facial skin and the muscles underneath are extremely thin, which is why neurotoxin injections can only be made onto the skin top layer of the skin. Otherwise, the Botox would go too deep and cause facial paralysis, creating the same effects that other patients experience when the drug is deliberately used to remove wrinkles. The Chicago surgeon recently published the results of his experiments in the Journal of Drugs and Dermatology, and he is currently offering his Botox method for patients who have had no success preventing their breakouts with antibiotics, light therapy, or other conventional treatments. In our next story, a radical new contest is underway in New England that will treat the winner to free hair plugs and Botox injections. To qualify to win, however, this person will have to be both unemployed and very unhappy with what he or she sees in the mirror. Leonard Hair Transplant Associates is sponsoring a contest for jobless residents in Rhode Island and Massachusetts. It's based on the premise that succeeding in the job market comes from being confident, and that confidence can be increased through a more attractive appearance. Unemployed residents have been invited to submit photos and personal statements through a website. They're being asked to persuasively explain why they need and deserve the cosmetic procedures more than anyone else. The competition will select 20 finalists, and from that point, the public will be invited to choose one winner and one runner-up, American Idol style. Leonard Hair Transplant Associates has seen an increase in patients seeking hair restoration for job reasons and hit upon the contest as a way to celebrate 20 years in the business. Some are calling the contest irresponsible and unethical, saying that offering cosmetic surgery as a contest prize disrupts the traditional relationship between doctors and patients. But statistics can't be ignored. The national unemployment rate was 9.5% as of June. And a recent survey by the American Academy of Facial, Plastic, and Reconstructive Surgery confirmed that 3 out of 4 surgeons had helped patients who sought an operation mainly because they wanted to stay competitive in the job market. Coming up after the break, we'll find out who is getting plastic surgery in the U.S. and why, and then take a look at a gel that takes some of the sting out of laser treatments. But first, a quick break. We'll be right back.
You've invested a lot of time planning your plastic surgery procedure. You don't want to leave anything to chance. Now, there's an easy way to have peace of mind about your surgery. CosmetiSure. Every surgery has some risk of complication, but most health insurance policies won't cover complications arising from elective surgery. Cosmetasure is an affordable, short-term coverage designed to protect you from the financial impact of possible complications. Cosmetasure is only available through participating physicians. Before your surgery, ask your doctor about coverage with Cosmetasure so you can rest assured.